studies have shown that even from an early age, mothers react more negatively to aggression in their daughters than in their sons. And again, this limited research, much research, what is there, it supports the difference in the socialization pattern of anger expression. And Cox identified 4 different ways that women divert anger through anger containment, a conscious attempt to restrain the expression of anger, anger internalization, which is a suppression or denial, that of the anger itself, dissociation, just having little no awareness of the anger, and then in some cases, yes, through aggression, which is usually towards directed towards the less powerful. The last thing I wanted to mention is that in terms of men, because I do work mostly with men, the ones who usually come to treatment, most anger treatments are designed around the male-dominated form of anger expression, which is, where often some level of aggression is normalized. And but also for us as men, because sometimes the way that we're socialized to be the fixer, the doer, the go-getter, that emotions that imply vulnerability are cast aside. And often when I work with men with anger problems, and I ask them how you feel, it's usually I'm okay or I'm pissed off. Okay, pissed off. There's no mention to sadness, disappointment, regret, fear. So part of the process is teaching the men those emotions, teaching them to experience and to express those emotions more effectively. I included some implications for treatment there, for practice in the treatment of men and women. And the main thing is to recognize that most models of anger treatment really do not address gender issues as they relate to women. Mostly just focus on, they have been designed for men. So when women come to treatment, I think it's important for those of us who are in practice and who work, possibly work with individuals who are having anger problems, to explore the issue of anger and to help the woman give a voice to her anger, verbalize that, normalize that, and find ways to help her express those anger feelings in a more productive, healthy, socially appropriate manner.
You want to take a few
questions?
Yeah, I want to give time for this.
Sure. Yeah. I want to stop now, and if anybody has any questions or comments, I'd glad to. Yes.
One of the first things that I noticed in one of the definitions definitely presented was that anger is associated with negativity. And I don't necessarily understand why that should be perpetuated.
Yeah, negativity, meaning the judgment that we make of a situation, that we judge the situation to be detrimental to us. But anger itself is not negative, because as I said before, anger is a common, normal human response that sometimes is necessary for us to bring about change. And I think a lot of social change maybe has, been influenced by that experience of anger that has been channeled into more socially appropriate ways of expression.
I think she's reading the definition, though. It says a negative phenomenological feeling state. Is that what you have in mind?
I was okay with his response.
Yeah. So, what I mean, that anger, when we experience anger, it has some negative affect. It affects us in a way that it propels us to either change the situation because it's something that we don't like, we have been treated unfairly, unjustly, in some. So, it's sort of like that, sure, in terms of specific words, but it is an adverse affect that, now if we use that appropriately, then we can bring about positive change. If we, or some individuals may just use that anger to engage in detrimental acts, or that may bubble inside and then turns into other kinds of physiological problems. I'm not sure if I'm answering your question.
It's a good starting point for the discussion.
Yeah, thank you.
I have two questions.
Sure.
First, did you think about the distinction between spontaneous anger and structural anger? Spontaneous anger is something happened to me and I'm getting angry.
Exactly.
Structural anger is I'm Jewish, I was discriminated all my life, and I'm angry. And once in a while it's coming out.
Yes.
This is the first. Second, I'm leading negotiations, Israelis and Palestinians. One of the ground rules is that you don't put down each other and not go to historical debate. This is probably one of the ways to control our emotions, to let the cognition play. But it's very, very difficult.
Yes.
It's much more easier to shout, to speak about the past, and when I'm thinking about anger, to control your anger, sometimes it's very, very difficult because you have to use your cognition and you need help in this.
Yes. Yeah, I think exactly. You're right that sometimes anger becomes very automatic. And for some individuals, that anger reaction becomes almost an instantaneous response to a situation. And again, it doesn't necessarily have to be that the reaction has to be maladaptive. Sometimes it could be just a step to correct the problem. For some individuals, maybe that instantaneous reaction could be more maladaptive to aggression, verbal, physical aggression. But for some individuals, I find that they may be, readily affected by the anger, but they keep it inside and they don't express it. That also can be very damaging. So there's indeed a difference. And also I find some individuals who anger tends to develop in a lower pattern, sometimes very connected to other issues, unresolved issues that they have. But again, I think from the conceptualization process, what I look at is this pattern of the perception of losing something of value, and also the projection of blame. I think the other point that you bring, which is the derogatory aspect of the expression of maladaptive anger, sometimes putting the other person down, or certainly, that in itself fuels even more anger. Because again, the more we devalue the other individual, the more we believe that this person deserves to be treated with anger or with aggression. And how do you change that? Well, anger treatment certainly is not a short treatment, because we're talking about changing deeply embedded patterns of beliefs that the person has. And particularly given the fact that most individuals who come to anger treatment are not there, it's almost like substance abuse. They're not there out of their own volition. Often they're coerced. So you have to gain their trust, and you have to help them to see how these cognitions play into the whole experience, and also appeal to the self-interest of the individual. And, how is it important for you to change, in order for you to maintain your family, your job, or whatever benefits you want to get out of it.
So I have 3 comments. I guess I have to make them quickly. Often definitions of internal states can be given sort of in terms of necessary and sufficient conditions, like you can define a square or something.
Sure.
That would be. So often they're defined in terms of the effect of some typical event or action or something. So what's a pain? Well, it's what a person typically gets when he hits his finger with a hammer or something like that. And I think actually there's a very simple definition of anger which allows actually for many sources. But you could say, turning to that definition on the second page, the second one, it's an emotional state that typically results from believing that you've been treated unfairly or unjustly or something like that. And that state may be caused by many different things, and yet that's kind of a reference-fixing definition that sort of points to the